everyone, my name is Emily Rossman and I chose Case Study 62. The patient in Case Study 62 is having a thorough physical examination. The patient, Jane Doe, is a 13-and-a-half-year-old female who has not had her first menstrual cycle and is not showing signs of breast development. She also has an unusual webbing of the neck, a smaller jaw, and skin folds around the eyes and or drooping eyelids. Jane has never been tested for a chromosome disorder and her family has no genetic diseases that have been diagnosed. She has very little medical history except for recurring middle ear infections and a case of the measles. The patient has had no surgeries, her immunizations are up to date, but has some allergies to certain medications. In addition, Jane has been an average student and seems to be friendly, relaxed, and alert with no distress. Some of the patient's vital signs appear to be normal except for her blood pressure, weight, and height. Her blood pressure is 145/95, which is considered to be high blood pressure. Likewise, Jane has an irregular height and weight for her age. She is 4'7" and weighs approximately 121 pounds. Jane has normal skin with no rashes, tumors, or bruises. However, she has 15 to 20 dark moles on her chest and back. In addition, the patient's turgor is normal. The patient has a visual perception of 20/50 and wears glasses. Another hearing test has been suggested because there were some hearing difficulties. Otherwise, the patient's head, eyes, nose, and throat appear to be regular. The neck, lungs, heart, and abdomen have no irregularities, and despite the lack of breast development, the chest is broad and has widely spaced nipples. Jane's musculoskeletal, extremities, neurological, and pelvic exams had no findings. Lastly, the patient's laboratory blood test results have several abnormal outcomes. The patient's chloride, glucose fasting, total cholesterol, low-density lipoproteins, follicle-stimulating hormone, luteinizing hormone, and growth hormone levels were irregular. Overall, the patient shows signs of Turner syndrome.